Hello, my name's Marty Holmes, and this is my abnormal psychology report. The mental health condition that I chose was obsessive compulsive disorder, also called OCD. The character I chose was Blanche. I thought she was quite interesting, so I chose her. I chose season 1, episode 4. And when you go into my link, you will have to rewind it to the very beginning and watch the first 4 minutes. In this clip, it will show Blanche and her roommates. They're cleaning, she's arranging things, and she's talking about her visit of her sister. Her sister's coming to visit. And she's very anxious about this visit. And at one point, she didn't even want her roommates to sit down. As her therapist, I would have a patient profile, and this would be it. Her name is Blanche Devereaux. She's about 53, but refuses to confirm. She's female, a widow, and she's a retired former art assistant. She lives with 3 roommates, which actually they're her renters, and they're all older women. Blanche's issue is that she's anxious about her sister's visit. She feels inferior to her sister and she resents her for stealing the affection of her father. As Blanche says, when Virginia was born, Blanche thinks that she herself ceased to exist. And because of her anxiety, she's thrown into a cleaning frenzy to try to calm herself. Obsessive compulsive disorder is a debilitating mental condition characterized by obsessions. Obsessive behaviors become compulsive because patients seek to calm or control themselves through their behaviors. Obsessions are uncontrollable, irrational thoughts, images, or urges that a patient tries to avoid. The compulsions are the repeated thoughts or actions that the patient exhibits to achieve this control or calm over their thoughts. There are 4 behavior types. Symmetry, which is the need to have things in a certain order. Blanche is probably showing a combination of symmetry in the cleaning behavior type because she has to have the house arranged in a certain way, and she was obsessing about also having a decorator because she wanted the house to look a certain way, and the cleaning. A perfect example would be if you ever saw The Odd Couple, the character Felix Unger. He is his behaviors are more on the symmetry level. He has to have everything just so: his clothing, the apartment, things in the house, and he also has to have everything clean. He's very clean, he's a neat freak. Forbidden thoughts and acts are fears and urges to harm self or others. And then you have the cleaning and contamination, fear of germs and contamination. This is where a person washes their hands and hair and takes showers often. Then you have the hoarding. Hoarding seems like a new category. If you've ever seen the show Hoarders, many people collect things. The longer you stay in an area, the more stuff you accumulate. But with hoarding, it's a fear of throwing things away. So many times they hoard to a point that they can't enjoy their surroundings, their house. Maybe they can't even walk in their house, some people, because they have so much stuff, and it really gets to be problematic. At one time, people used to just think if they just cleaned the house, they'd be all right, but there's a bigger issue than just cleaning the house. It's the fear and the anxiety that keeps them clinging to objects. As a therapist, the discussions that I would have with Blair would be about forgiveness and forgiving her sister. I'd also ask her what is upsetting her about her sister, and I would try to keep things in the present tense. Like, what you want to do is you could talk a little bit about the past because that's what Blanche does, but you have to bring her to the present and have her focus on how she can have a better relationship with her sister in the present, because you can't change the past. You can talk about the past to understand how you feel, but in order to make improvements on a relationship, you have to focus on the now. Discussions her roommates and friends might have with her. Her roommates might try to get Blanche to admit she has a problem and to seek help, talk to a professional, and get treatment. Levels of impairment. Obsessions and compulsions can disrupt a patient's daily functioning. Example, a patient spent 3 hours trying to park their car perfectly, and because of that, they got fired from a job, which that was very disruptive because you need a job to sustain yourself. Patients have different symptoms, and these symptoms can affect their lives differently. So some people can be high functioning and they'll be able to work and do things and not be too bothered, but others, say an example be hand washing to the point of rubbing the skin raw. In Blanche's case, she has 3 roommates she lives with. And anytime you're living with somebody else, you have to be able to get along and communicate. And her obsessions and the behaviors could make their living situation very difficult. Treatment options. There's 3 treatment options for OCD. You have the psychological, you have medication, and then you have something called psychosurgery. Psychological treatments are exposure and ritual prevention, also ERP. And with this, the therapist, myself, I would seek to modify or adjust her behaviors by exposing her fear in therapy. So we discuss her fear, maybe even put her in situations, modified situations, where we could try to have her manage her behaviors And if that failed, then I would seek medication. Medication in this point benefits up to 60% of patients with OCD. I'm not sure if I'm saying this right, but it's called clomipramine. Clomipramine. And the last treatment is called psychosurgery. And this is a type of brain surgery to treat OCD, which this is a last resort. It's only used if medication and psychological treatments aren't successful. There's also deep brain stimulation, which is another radical treatment, which would be another last alternative, which myself, because of the age of my client, I really wouldn't do this option. Maybe with a younger patient, but not with her, unless it really became a necessity. And here are my references, and this concludes my project. Thank you, everybody.